thank you for coming along to this event on delivering innovation in the NHS here in the north of England. My name is Andrew Stephenson. I'm a former Minister of State of the Department of Health. I now chair a NHS trust over in Lancashire, dare I say. I am co-chairing today's event with Paula Sherriff, who will introduce herself in a moment, and our keynote speaker who's going to kick off this event. But just to say a few words briefly about Curia. Curia is a non-political, non-for-profit policy institute, and it's about turning policy into practice. So when the government's bringing forward policy ideas, we want to see about how we can implement them, how we can ensure that that actually delivers change on the ground. So we look at a range of issues. Today we're starting off talking broadly about innovation in the NHS and innovation more generally, and you're going to hear also from Tim Flagg from UKAI. But we are then going to have a deep dive this afternoon into obesity and women's health. That's all I'm going to say for now. I'm going to hand over to my co-chair, Paula, to introduce herself and to introduce our speaker. Thank you.
Thank you, Andrew. Welcome, everybody. For those who don't know me, I'm Paula Sherriff. I work in my day job, I work for West Yorkshire ICB in the Improving Population Health team. I'm joined today by some of my brilliant colleagues. But I also support Ben at the back there, who's the Chief Executive of Curia, and we've heard a little bit from Andrew about what Curia do. It's great to be here in Barnsley, the UK's first tech town, and we'll hear a little bit more about that. But I'm absolutely thrilled that Oliver Coppard has been able to join us today. I've known Oliver, 12, 13 years. Yeah. So yeah, it's fantastic. Oliver is the first mayor of South Yorkshire.
Second.
Oh gosh, I'm
Dan
sorry.
Jarvis.
Oh my goodness.
Dan Jarvis.
Sorry, Dan.
Yeah.
Oliver is the second mayor of West Yorkshire. Thank you for keeping me right. He's just going to talk a little bit about what's going on in South Yorkshire.
Yeah, and there's a lot. Thank you. Hi everyone. Andrew very kindly didn't mention the reason we're late is because I was late. So apologies for keeping everybody waiting. It is genuinely really nice to be here with you today, particularly in this room. The last time I was in this room was when Barnsley were playing Chelsea in the FA Cup. I'm not a Barnsley, I'm an Arsenal fan, and we beat them. Barnsley beat them 1-0. It was like Mourinho's Chelsea, and I was over there. So this is a special room for me. It was a great day, if only because Chelsea lost as much as Barnsley won. Thank you to Curia, NHS Innovation Accelerator, NHS Regional Teams, Health Innovation Network for bringing us together today, because this is an important conversation. It is rare, I think, to have ICS leaders, innovators, academics, policymakers, parliamentarians, former parliamentarians in the same room, all focused on the same ambition. And I do think we have the same ambition, which is making sure new ideas, new technologies, new approaches reach the people and places that need them most and reach them much faster than they normally do or do right now. For me, that goes to the heart of our mission here in South Yorkshire. And I'm really proud, obviously, to be the mayor of South Yorkshire with all the brilliant things that are going on here. But my focus is absolutely, just like yours, all about better health, stronger growth, fairer outcomes for people. And it speaks directly, I think, to the purpose, the absolute central purpose of devolution, which is shifting power away from London. And that isn't just an abstract or bureaucratic goal. It's a practical way, I think, of giving places like ours, like this one, the tools, the freedoms, the accountability that we need to tackle the challenges that we collectively understand better than anyone else. And I do think that is right. And to act on the opportunities already that are there right in front of us. And part of that just comes down to how close we are, proximity. The challenges are big, they're messy, they're deeply rooted in place. You know that, I know that. When I'm in Tesco's, when I'm down the pub, at the football, at Park Run, I'm surrounded by the people that I'm here to serve. And no doubt some of you in this room are those people. Sometimes they tell me, you tell me very directly what they think, certainly at the moment. If I could hide in this room for the rest of the day, or at least the rest of the week, I would appreciate it. Sometimes they do it on social media, sometimes they do it in the queue, at the bar, at the urinal even. Some still even send letters. And some even come to our events, which is always very nice. But as a mayor, I am close to the problems that our communities face. And I'm even closer to the solutions. Mayors can see into corners of our communities that often go unnoticed, unseen, not because people in Westminster don't care, of course they do, but because national systems simply don't have the time or the space to look as closely as we do. Devolution gives us the ability to notice what's changing, understand why it's happening, and respond quickly with policies that match the reality on the ground. Tailored policies, tailored approaches. That closeness to our communities isn't just a strength, it's the whole point of bringing power closer to people, of devolution. South Yorkshire is a place that's always built its own future. I'm really proud of that. We have a history of innovation, industrial, technological, social. We're a region of makers, of grafters, problem solvers. Innovation's always been part of our identity. Today it's central to the future that we're shaping though, not only for the strength of our economy, but for the health and well-being of all of our communities. Because of devolution, we're able to take that ambition and turn it into something that genuinely works for people right here, for everyone across South Yorkshire, rather than something designed miles away from the realities of our daily lives. We're really fortunate to have extraordinary institutions across South Yorkshire. Our local authorities, great businesses like Westfield Health, Cannon Medical, B. Braun, world-leading universities, outstanding hospitals, the Olympic Legacy Park in Sheffield, fast becoming the beating heart of the prevention economy. But what really matters is that thanks to devolution, we also have a shared mandate and shared powers to pull all that together. And that hasn't happened before. The case for doing that's never been clearer, in my view. The Health Innovation Network's work last year found that reducing ill health through innovation could add 246 billion, with a B, a year to national productivity, almost 10% of GDP, alongside billions more in new investment. Improving health isn't just morally right, it's fundamental to our economic success, certainly here in South Yorkshire. And we're not waiting for someone else to make those connections for us. We've already done it. We've built it into our local growth plan. It shapes our prevention strategy. And we're using our devolved powers over transport, over skills, regeneration and innovation to put that into practice. Too many people across South Yorkshire are living shorter lives. You will all know that in Barnsley, women have the lowest life expectancy of any place in the whole country. People are spending too many years in poor health, 20-year healthy life expectancy gap in South Yorkshire. That harms individuals, it harms families, it harms communities, and it holds back our economy. But the ingredients to change that are already here in many ways. The key is making the system work in a way that matches our ambition and is tailored to our needs. Take the Pathways to Work programme. We've been able to design something tailored to local need rather than applying a national template. Working with Sir Charlie Mayfield on the government-backed Keep Britain Working programme, we're developing new ways to help people stay in work or return to work after ill health. It's the sort of innovation that doesn't fit neatly into national frameworks, but it does thrive in devolved ones. Look at the Olympic Legacy Park. It stands as a powerful example of what happens when we have the freedom and the confidence to back ourselves. It brings together the MCA, Sheffield City Council, the NHS, our universities and industry, a partnership that a Whitehall department, I'm sure colleagues would agree, wouldn't be able to construct simply from the centre in place. It creates a place where prevention, sport, well-being, research and economic regeneration are one of the poorest parts of South Yorkshire, sit side by side and feed into each other. It's also one of only two places in the world to have the moniker Olympic outside of an Olympic host city, and we're very proud of that. Within it, the Advanced Wellbeing Research Centre, the AWRC, serves as a real-world testbed for health innovation, central to our mission. Patients, clinicians, researchers, businesses work alongside each other every day to design solutions rooted in our communities here in South Yorkshire and their needs. And that works because relationships are, of course, by definition, mostly local. The mission is shared, and our model of local leadership allows us to move quickly and it allows us to be collaborative. In fact, it demands it. And soon we'll add something remarkable to that ecosystem, the National Centre for Child Health Technology, a £22 million partnership with the NHS, central government and ourselves. We're putting in £6 million from the MCA, creating world-leading, world-first technologies to support children's health. Robotics, VR, long-term conditions management, mental health tools, a national asset, and it is a national asset, potentially an international asset, delivered through collaboration, right here in South Yorkshire. When we talk about levelling up, and I know we don't use that term so much anymore, that's what it looks like in practice. Then there's the South Yorkshire Digital Health Hub, a £4 million initiative led by the University of Sheffield and Sheffield Hallam University in partnership with Sheffield Teaching Hospitals, the ICS and the MCA. It uses NHS data, AI, wearables, digital tools to enable early detection and better management of conditions like cardiovascular disease, cancer, mental health. Alongside that, the South Yorkshire Innovation Hub within the ICS has already secured more than £1 million of additional funding for digital health solutions. Devolution helps us to align investment so it lands where it matters most. And we know, you know, where it matters most. And we're already seeing what that looks like on the ground. Look at Barnsley's Health on the High Street programme, where I was with West Streeting just last Thursday. I think it is a brilliant, leading example of how locally led innovation can transform access to care. Barnsley Council and the NHS, supported by us, have worked together to put health services right in the heart of Barnsley's town centre, a town centre that frankly needed some help. In places people actually use, actually visit. You can get support for stopping smoking, managing your weight, improving your mental health, getting more active, all in a friendly, accessible, walk-in setting right on the high street next to a Costa. People on average, when they go in to use Health on the High Street, spend £17 per person. So it helps the high street, it helps patients, helps the NHS, helps the council. It's simple, it's human, it's working. It reaches people who might never walk through the doors, or not willingly, of a clinic or a GP practice. And it only happens because local leaders understand their communities, our communities, and have the freedom, the power, the money to respond to local conditions. But even with the advantages that devolution brings, we still face a national issue we can't solve alone. The slow pace of adoption across the NHS. From Barnsley to South Yorkshire still takes too long, let alone to the rest of the country. Too many proven innovations take years to reach the front line. Too often, the first beneficiaries are those with the most resources. Look at the new obesity medicines. The vast majority of early prescriptions have been private, and that tells its own story. So what needs to change? Firstly, national government needs to change. The imbalance in national research funding must be addressed. It can't be right, it is not right, that a single institution in London, the Crick, receives the same level of public research funding as the entire north of England. I actually think it receives more than the north of England. I've written to ministers proposing an Institute for Preventive Health Research for the whole of the north, as a recognition that regions like ours don't just have significant health challenges, we have world-class assets to address them. Government also needs to provide devolved regions with greater freedom to direct research and innovation funding towards our own priorities. We know our health needs better than anyone else. The tools should match that knowledge. The NHS needs to change. The pace of adoption has to increase. We can't wait a decade for proven innovations to reach patients. Procurement needs to be more agile. Evaluation processes need to be faster. And the path from pilot to scale needs to be clearer across ICSs. The NHS also has to invest in the workforce and in digital infrastructure. You will all know that better than me. Innovation only works when clinicians have the time and support to adapt to it and adopt it. Our data systems must be more interoperable. And we need a modern approach to NHS data that enables research and innovation while protecting patients' trust. And finally, for all of us as a regional system with devolved powers and shared responsibilities, we have to continue to weave health into innovation into the fabric of our economic future. It is here in South Yorkshire. That's why it sits at the core of our local growth plan. It's not an add-on thought about afterwards. It's central to how we build a stronger, a fairer, a healthier South Yorkshire. We need to make our innovation globally relevant, but grounded in the needs of our communities. Devolution does make that possible, but not inevitable. We can attract world-leading partners and ensure their work improves people's lives in South Yorkshire, but we have to work to reach that goal. We need deeper, stronger partnerships. That's why we're launching our new academic health partnership, bringing together the MCA, chaired by the MCA, the ICS, our universities, local authorities and industry, and joining up research, innovation, care, and economic growth. And above all, we have to put health equity at the centre of everything that we do. We have to ensure progress benefits people in Barnsley, in Doncaster, in Rotherham, and in Sheffield, not just those who have always been closest to opportunity, to wealth, or to power. Innovation should help narrow inequalities, not widen them. Programmes must be co-designed with our communities, in our communities. New technology should be tested where and how people live their lives, not only in specialist centres far away from people. That's how we build a connected South Yorkshire. That's how we make South Yorkshire the healthiest region in the country, as I have said we need to be. One where innovation moves faster, reaches further, delivers more fairly, because it's shaped through local people's needs and through devolution. We need a South Yorkshire where better health leads to better jobs, stronger families, and a more prosperous future. A South Yorkshire that doesn't wait for permission to lead, but shows the country and internationally what's possible. Thank you very much.
Thank you so much, Oliver. I know you're short of time, but we're just going to have a quick chat, if that's okay.
Shall I sit? Shall I stand?
It's entirely up to you, but whatever you're most comfortable
with.
I just want to introduce our other guest this morning, and you touched on AI in your speech, and obviously we know that Barnsley has been recognised as the UK's first tech town,
yes,
which is fantastic. And we're joined by Tim Flagg, who is the CEO of UKAI, and we'll be hearing from you in a moment, Timmy, if that's okay. So thank you so much for joining us today. You've been really clear, Oliver, that devolution only matters if people feel difference in their everyday lives. And you've also talked about how the frustration that we all feel sometimes at the speed of that devolution. So from South Yorkshire's experience, could you perhaps give us your two top practical things that you think regional leaders must do differently to ensure that innovation actually translates into frontline NHS pathways and not merely just sort of concepts or strategies and pilots?
I mean, I certainly think one of them is just about leadership, right? It's about giving people that you work with the permission to do things differently, and allowing that ecosystem to flourish by saying to people, actually, let's try some stuff. Let's try some new stuff, right? And it can be not as simple as that, but it can be as straightforward as that, because I don't doubt there are great ideas. Innovation AI is absolutely at the cutting edge of innovation, but so is a nurse, a doctor, a healthcare professional doing something differently in their practice and then spreading that out across the system. That is also innovation. And sometimes what we do is clamp down on that innovation by saying, actually, you don't get to do that. And I think increasingly what we've got to do is give people permission to trial, test and learn from that innovation, and learn from the bottom up, not try and enforce it from the top down. And I think that's where devolution really comes to the fore. Because as a leader, as a mayor in South Yorkshire, being able to say to my team and through my team, other people in that system, let's try and think bigger, let's try and do better, let's try some new things and give each other permission to try and sometimes fail. Because ultimately, we're not going to get this right every single time. And we have to put patient safety first, of course,
and also
patient trust.
Sharing those successes and failures with other regions.
Absolutely.
So that we can learn if they've done something that went particularly badly, we can
100%.
Obviously not make those mistakes.
So Barnsley Council started the project to redevelop the town centre in 2002 maybe. In 2008, the funding for it fell flat when the financial crash hit. So it was Barnsley Council were a week away from signing a deal with HSBC for £500 million renovation of Barnsley Town Centre, which was going to be largely just shopping. Just largely going to turn it into a shopping centre. And they lost the money, and then they went back to the drawing board and they tried again. And then they've got this town centre focused on community space, libraries, a cinema, bowling, a market, a food hall, and a health hub. And that kind of failure led to success. And we often know that that's the way it works. But then when we reach that point in our own lives, we kind of like give up because it's a bit scary and someone's not backing us. So I think collectively, let's just be a bit braver. Let's try a few things differently. I have said South Yorkshire needs to be the healthiest region in the country. And I say that in front of a group of healthcare professionals, right? All of whom know just how hard that is. And to some people, how ridiculous that sounds. I don't say that because I think I'm going to be the person like cutting the ribbon in front of a big banner somewhere saying we did it. And we're like Japan with like 95-year life expectancy. I do it because someone's got to turn the tank around. Sure. Someone's got to be able to say, right, we're going to shift that and we're going to try and do something differently. And maybe in 30 years' time, we'll be there. And hopefully at that point, I'm still around because I'm then living a really healthy life.
I'm sure you will be.
And I can say, oh, I had a bit to do with that.
Yeah.
But frankly, we all need to be a bit braver. We all need to try some things differently, and we all need to give each other permission to do that work.
So in terms of the role of mayors in NHS delivery, and I understand at the moment that health isn't devolved in South Yorkshire, but maybe in the future, we often talk about the NHS from a national perspective, but delivery is increasingly local. So how do you see the role of mayors evolving in unlocking innovation across ICSs, particularly where levers sit outside the NHS, like skills, digital infrastructure and economic growth?
So I think prevention is the place where I would focus. So I was talking to Penny Dash the other day, I was talking to Wes the other day, I've spoken to Alan Milburn about this at length, about health devolution. Myself, Andy Burnham, when he's not running for Prime Minister, don't record that, we're all kind of very focused on this idea of like, how do we get health devolution into the system? Because at the moment, the government, I think, rightly, in lots of ways, are very focused on the acute challenges that the NHS face, right? And so kind of systems change, albeit they've taken on the big kind of beast of NHS England.
Don't we know it?
Yes, indeed. As the chair of the ICB, I knew it well. Look, so we've got to kind of make sure that conversation carries through this process of huge change. Because actually, I think, as I've said in my speech, mayors' devolution offer a huge amount to the system. I'm not saying I should be responsible for setting up through my team or deciding on where a local maternity unit goes. I don't want that responsibility, frankly. That is best made by professionals who know the system and know it well. It's not a political decision. But there are political things, there are things related to devolution, there are ways of bringing this together as a convener in place that can allow prevention to flourish as a system that you can't do from Whitehall, as I already said. That we all know that left shift, that adoption of innovation, that focus on prevention doesn't happen through the NHS in the way that it could or it should, because the NHS is always under political pressure to focus on acute challenges. Sure. Now, of course, I'm under pressure to focus on acute challenges too, but not in the same way. And by bringing together skills, transport, public health, innovation, education, universities, you name it, together in the same room and saying, right, how are we going to do this differently then? 1 in 5 bus journeys in South Yorkshire relate to healthcare. So either a nurse, a doctor, a care worker going about their day, somebody going to the doctors, whatever it might be, 1 in 5, right? So you can't have a functioning healthcare system without a functioning transport network, but at the moment the two things don't really speak to each other because the bus network is run by private companies like Stagecoach and First, and the healthcare system is run by Whitehall. Problem. Absolutely. We're taking the buses back under public control. When you align that to a public health remit and a prevention remit, all of a sudden you've got an opportunity to do things differently, and that's where I think we should go next.
Thank you, Oliver. I feel South Yorkshire's in very safe hands right now. So turning to you, Tim, we've heard today about new tech and AI investment here in Barnsley. So what does this announcement tell us about how AI can move beyond proofs of concept and into trusted operational use, especially for the benefit of the community? And I just wanted to pick up on something that Oliver said earlier around how we can be interested in your views on how we can use data. Oliver talked about wanting to make South Yorkshire the most healthy region in the UK, which is a great aspiration and ambition. But how do we use data to quantify some of those areas?
Yeah, well, Firstly, I think it's really exciting that Barnsley has been designated as a tech town, and what a great opportunity to actually create an exemplar here of how to do it right, and then for other parts of the country to come in and learn. So for those of you that don't know UKAI, we're a nationwide organisation. We've got over 200 members that represent businesses who are either building AI or adopting AI. A lot of those are doing that within the healthcare sector as well. We had a showcase where we brought together a number of different businesses, all aspects of healthcare, everything from diagnostics to actually creating avatars that speak multiple languages that can help triage patients when they come in, many different use cases of it. And one of the things that we see most is the challenge around scale. So a lot of those companies will be based in one particular NHS trust, and they struggle to then try and get it replicated in another NHS trust because they're all very, as you will know, they're all very different. And so they've sort of hitting this kind of level where they can't scale. So I think the opportunity is how can we then take those companies and introduce them and help showcase what they're doing, introduce them to more places. We're trying to do that through showcasing, but also I think there's an opportunity through these, having said that, there are many local advantages. There are some advantages in central government as well. And DHSE have actually got a very innovative team there now who are looking to engage with some of our members to help showcase what they're doing through, I'm sure you're all aware of the AI Ambassadors Network and the knowledge repertoire. So using those mechanisms to showcase out and spread those great ideas. And then I think it's, to your point about data, it has to be measured. So there are some really good case studies now where they have got results, but people just don't know about them. And it's about being able to kind of like search.
And sometimes the sharing arrangements can be really, really difficult to navigate as well, even between sort of the ICS and local authorities and the.
Yeah, absolutely. And so part of the challenge is just being able to make sure that we get access to those case studies and can break them down into ways which are shareable, both from a political perspective, but also from a data security perspective, and then share those with people so they can understand how it can be used and then adopted locally as well.
Thank you. So moving on from that, what have you both learned about the conditions needed for AI to scale safely in the NHS in terms of data readiness, which we've just touched upon, workforce confidence, governance, and where do systems most often get stuck?
We were talking about this with Liz Kendall when she came to launch the Tech Town concept, and actually with Wes as well, saying actually the NHS I think could be really significant in the adoption of AI in this country and more widely, because I think people are so trusting of, rightly, the NHS. There's that really close relationship. I think if they can see that the AI through like passive listening, for instance, actually adds to their healthcare and helps them and is trusted by doctors, by nurses, by healthcare professionals throughout the system, then I think it will speed up the adoption of AI more broadly.
Thank you.
Because you don't mind using AI in Burger King if it's used in your GP surgery, do you? So I think that is a really important role that the NHS could play.
Do you know where we're at at the moment in terms of public trust in AI? Has there been any good surveys that say, as it stands, would you trust AI in healthcare? Where do the public sit right now?
I think the public are rightly sceptical at the moment. So that is one of the biggest challenges for the adoption of AI across the country. And when you talk about AI can mean many things, right? The majority of people think about it being a chatbot, but there's actually a lot of data science, there's a lot of automation, there's lots of different, and as you will know, I'm sure we're using it in many different ways within the NHS and healthcare particularly. So for me, it does come down to confidence.
Yes.
But confidence will only come if people trust the AI. So I think, to your point, I think you're right. The NHS could be a fantastic way of actually getting people to see how it can deliver for them, because they have to see it's relevant to their lives and they have to then understand how it works. So if we can start to do that, which we're trying to do at a national level through education, which comes back to skills, if we can do that, we talk about everyday AI skills. So it's not about learning how to code, it's not about learning the technical skills, it's just feeling confident.
And the government are offering courses, aren't they? I understand. So I understand you've got to go.
Yes, I'm afraid I do.
No, thank you so much for joining us this morning. Really enjoyed listening to you and really excited to see what South Yorkshire's going to do.
Thank you. Thanks, everybody.
Tech Town.
Thank you.
Thank you very much.